tell us just a little bit about your study, will you please?
Yes, we started to evaluate our patients with MDS, who are mainly elderly people above 60 years of age and above 75 in the majority of cases, for their comorbidities. Because we had the impression, and now we have the data showing that patients with high scores of comorbidity do not get appropriate treatment.
Now you're using azacitidine. What difference did the comorbidities make?
Now, in fact, patients with high comorbidity, evaluated with different scores, receiving azacitidine did show the same improvement, hematological improvement, complete remission, as patients without comorbidities. Meaning that, in fact, we have to treat these patients and they deserve to be treated with a standard azacitidine therapy as the other ones, even if comorbidities, of course, influence outcome in the sense of overall survival because of their intrinsic severity.
Within that group of older patients, were there differences between subgroups of patients?
Indeed. Patients with lower comorbidities, you know that comorbidities are judged by scores, precise scores, they do get shorter overall survival, even if they respond well to azacitidine. So now our further goal and steps will be addressed to evaluate whether treatment with azacitidine significantly prolongs survival even in comorbid patients.
So what's the main message coming out of your study?
The main message is that patient or elderly patient, and especially very elderly, so above 75 years of age, should be evaluated also with comorbidity scores before treating with azacitidine, but they have to be treated.
But they do benefit.
They do benefit, they do achieve a response, and they do not show more adverse event or less tolerance than not comorbid ones. So.
And I can't possibly let you go without asking you about the Rome meeting, because there's a meeting in Rome in 2011 in March that we're all getting quite excited about, and it's about cancer in older patients. What do you think is the importance of this meeting? You're on the steering committee, aren't you?
Yes, yes. The meeting, I look forward to this meeting because we are going to discuss thoroughly the problems related to ageism in a way, so the fact that many elderly persons do not receive appropriate treatment. And we want to discuss the data showing exactly the contrary, so that the patients, despite their age, can really have a significant advantage by being treated appropriately.
So you're saying there can be discrimination?
Oh, absolutely, yes.
But you think this could change?
It must change, because patients are really responding. They have longer survival for solid tumors and hematological disease. So there is a lot of attention now directed to elderly cancer patients.
Well, Valeria Santini, thank you very much for joining us
welcome.
here on a busy day at the American Society of Haematology.
Extremely busy.
And I hope to catch up with you in Rome at the Cancers meeting. So thanks for being on eCancer TV.
Thanks.